I am the project manager of a youth drug and alcohol project in Sunderland. I've been the manager now for coming up to about a year and a half. YDAP is the youth drug and alcohol project in Sunderland. It works with young people under the age of 18 around drugs and alcohol. We have got 2 workers who offer preventative and brief intervention work for young people. And we also have 4 workers who offer specific structured treatment interventions to young people whose use is more complex or more risky. We also offer training across the local authority area in drugs and alcohol, in engaging with young people around drugs and alcohol. And we also offer bits of targeted group work to specific young people who may benefit from more kind of focused work around drugs and alcohol. So the workers have found the transition, I think, a really positive experience. It's interesting because obviously we're still in the middle of COVID restrictions, and by and large, we're all sort of working from home. And in many respects, that would normally make migrating to a new system, I think, quite a significant challenge. However, I think all the workers have found the system to be quite easy to use, I think quite intuitive to use. So we're on sort of day 11 now. And so far, the workers' feedback has been really, really positive. We've started being able to record case discussions, supervisions on the system. Today, we've just kind of logged this first sort of safeguarding incident on the system, and that's worked in terms of how it's flagged up. So that's been really good. But so far, the feedback from the workers has been really, really positive. I think they've really enjoyed the fact that they've got their dashboard with their caseload on. They can see when their last appointments were, they can see when their upcoming appointments are coming up, and they can also see where they are in terms of each client, in terms of the assessment stages and which bits of work they need to kind of complete. So far, it's been a really, really positive step forward, I think, for us as a service and for them, particularly as staff members. 2021, we're hoping, is going to be a really, really sort of positive year for us as a service. Last year, we had quite a lot of goals and aspirations, which we either had to put on hold or we had to find sort of new ways of achieving those goals. So last year, we just brought out a package of training to be delivered across the local authority area that was by and large practice-based and needed to be delivered face-to-face. We ended up packaging parts of that to be delivered online, which is something we're planning to kind of continue to deliver this year. So each week we're offering some specific bits of training on drugs and alcohol via sort of the internet. But hopefully we're looking forward to getting back to delivering more face-to-face training across the local authority area. And we are also beginning a process of trying to embed some of the signs of safety approach to working with young people. So we've got some upcoming training at the end of March and April and May. And moving forward, we're looking to kind of think how we can kind of embed the principles of signs of safety into our practice, and also how ILLY as a system can kind of support and facilitate that kind of process becoming embedded. I guess alongside that, we're also thinking quite hard about how we support the young people that we're currently working with, and also some of the young people we will start to work with in 2021, specifically in relation to mental health. I think we all know the impact of COVID has been significant in many areas. And we see that obviously in terms of the economy and education. But I think we're not going to really see the true impact of it on young people's mental health until, the next year. So I think we're kind of quite conscious of about, well, how do we as a young person's drug service support the young people that we're going to have contact with throughout the course of 2021.